Hi, this is week one of community health nursing for Concordia University. And what I want to point you to is some of the important concepts that you're going to be looking at as you begin the course. And one of them is to have a realistic idea of the different workplaces in community health nursing. And I always think of community health nursing as a big umbrella, and then we have three different areas that we see out in practice. And the first one, and these certainly are discussed in your book, is what we call community-based nursing. And this is where nurses care for individuals, but they're ill. They're, the best examples that I can give you when I think about community-based nursing is an off hospital site, a clinic site, and some good examples would be caring for patients with kidney dialysis or for oncology. And also with the idea that when they work with individuals, they're also thinking about family members. And again, typically we think about caring for clients across the lifespan. And this certainly is true when we look at any um, of the different areas in community health nursing. The next one is more community oriented, and these would be um, independent agencies that decide to put programming out in the community to help, again, individuals, families, and when we look at that whole group philosophy, to preserve, protect, promote, and maintain health. And again, they're operating under the idea of using population-based strategies because they've identified some kind of vulnerable group or uh, um, group of patients that would need services provided. So, um, and just to, off the top of my head, give you some good examples, and again, with the idea that these are outside the hospital setting. Um, Manitowoc County, for instance, has a very effective smoking cessation program that is run independently. It's sponsored by Holy Family, but it is run independently of them off-site. And again, their goal is to help people to stop smoking or to decrease the amount that they smoke. Um, Maybe even Red Cross services that offer programming when disasters strike could be another good example of community-oriented nursing. Um, Parish nurses that work again with different religious facilities is a nice example. And I'll tell you one in Sheboygan County that I ran into just recently was through the Sheboygan Clinic, and they were working, there was a special program set up to work with people in the community, and typically they were receiving Medicaid, Medicare funds, and it was to get them to, first of all, they had funds to help with the cost of pharmaceuticals. And of course, there was paperwork involved with it, so the staff um, worked with these individuals along with their families so they understood what was occurring, and they helped them fill out the paperwork and get these supplies of their meds that they needed, possibly for a 3-month period of time at a much reduced cost. So that was another really good example of community-oriented nursing. And then the third one is the specialty of public health nursing. And this one definitely is always based on the idea of programming at the population level. So it's just like I talked about last week with the intro. When you do your community assessment windshield survey, any public health agency would be conducting a community assessment for whatever service area they have. So typically it's a county, but sometimes it may be a city if it's large enough, and they're going to go out and they're going to assess what's going on in the community, just like you're going to do with using your zip code information, but they're going to look at the whole community and see, again, what is out there, who the population is by looking at vital statistics and other kinds of databases, and also then doing some research into what their current healthcare problems are. And along, as I always said, they always want to identify strengths, but then they're going to look at the deficit areas so they can start to think about planning for programming that would service these individuals. And um, just to make it clear, because I think this is something you're going to see as you do some of the readings. But I know when I first started working in public health, I thought there was this nice chain of command from the feds to the states and to the locals. And with some programming there is, and with others not so much. It's just kind of depends what the focus area is and if there are funds coming from the feds or if it is directly funded through the states, or maybe some boards, local um, county city boards would put money into certain programming if they felt it was important. A couple other concepts that I want you to think about too is that public health also, as you can assume, is a governmental agency. And their tenant that they work under is that we want to try to provide programming for the greatest good for the greatest number of citizens. It's not somebody coming to their door and saying, I need this. It's that they're going to use that assessment data that they've gathered and they're going to determine what the greatest needs are and what the most vulnerable population groups are in their local service area. The other real important thing that, again, I want to point you to is that there are three core competencies that public health nurses need to exhibit. And the first one, as I've discussed, is this ability to assess the community. But they need to do it correctly. They need to gather the important information that's going to be able to give them a foundation for program planning. And with that is this assurance that they can do that, that this is a skill that they're competent in. And then the third piece is policy development, that when they decide that there is a real need in the community, that if they have to formulate and put in place certain policies to make it happen, that they can do that. So they need to have these skills in place when they work for an organization like public health. So that's kind of the crux of what I want you to focus on this first week with the readings and the other resources out there. I am hoping that the history of community health, public health nursing that I have out, it's a pictorial presentation with audio, that it does work for you. Please let me know if it does. I think it's just entertaining and it will give you a real nice picture of where we've come from. And then the other piece that is important for you to have a handle on is what the current healthcare system, how it's set up. And I know a lot of you are knowledgeable about that, but you want to look at both the private offerings and just realize the differences when you're working with people in the community, what kind of funding is available for them through their private insurance companies. Also, if they are engaged or are they're able to use funding from Medicaid or Medicare, what that covers. And then if you would pay particular attention, to the U.S. Department of Health and Human Services and their current healthcare offerings. They have a lot of agencies that work out with different programs out in the community. And as we move through this course, I'm going to reference some of them. But if you just look at that in your textbook, you'll get a picture of some of these other programs that, again, are really working to keep our community residents healthy. I'm also going to upload just a brief matching game that deals with this, so if you want to utilize that to help with your understanding. So I think we're moving in the right direction here. And again, this is something that I'll be doing weekly on Mondays for you. If you have questions, and again, if I have a number of students that have particular questions, I will reference them when I do these recordings. Your assignments for the week, if you would look at the end of the first PowerPoint, it lists them very nicely, and I talked about the major ones in the introduction last week. But this week you want to answer the discussion questions using, again, references with AP8 format. You also want to pick an environmental topic and just list it. That also is, that entry point is at the bottom of lesson 1 or week 1. And then as you start going to your practicum sites, make sure that you are recording your hours. That's something that's due at the end of the class period. If you have not sent in your practicum site with your mentor's signature, you need to get that in this week. That is just of utmost importance that we have those practicum sites in place so that you can get started on these activities. So let me know if you have questions. Email me, call me at home. Um, and if I can help in any way, I certainly will, and enjoy the resources that are available.